As you are aware, we play an important role in delivering quality healthcare at our health and wellness centers. Post-COVID-19, it has become even more necessary to have knowledge on infection prevention and control measures. These measures remain same for all patients at all times, regardless of suspected or confirmed COVID-19 status of the patient, and will help break the chain of transmission of COVID-19 and will ensure the safety of the patients and healthcare staff at your facility. So let's start. Hand washing. It can be done by using soap and water or alcohol-based hand rubs and by following the 6 steps of hand washing. Hand washing has to be done before and after every procedure. Before and after touching a patient and after touching a patient's surroundings. After exposure to any bodily fluids, after using toilet, and after removing gloves. Let's now learn about biomedical waste management. Biomedical waste management means any waste which is generated during diagnosis, treatment or immunization of people or animals or in research activities. We use a yellow bin which has a non-chlorinated bag for the following waste material: human anatomical waste, soiled waste, expired or discarded medicines, chemical and liquid waste, microbiotech and clinical lab waste. We use a red bin for contaminated waste material that can be recycled, such as syringes without needles, gloves, bottles, urine bags. We use a white translucent bin to dispose waste sharps including metals and needles. We use a blue bin, which is a waterproof cardboard box or container to dispose glassware waste. Cleaning. Now let's look at how to keep our equipment and surfaces free from infection. Wear utility gloves and an apron to protect from any splashes. Remove all items after use and immediately clean them in a solution made of warm water and detergent, preferably with a toothbrush. All items should be individually inspected and visibly clean. Rinse items with clean running water and air dry before sterilization. Surfaces. Use disinfection solution that is made of detergent and 0.5% chlorine solution to clean high-risk areas such as beds, tables, delivery beds, walls, ceilings, floors, and toilets. Disinfect medical equipment. Let us now look at how we can disinfect our medical equipment. Stethoscope must be cleaned with detergent and water or wiped with alcohol-based rub, spirit, swab before each patient contact. BP cuffs and covers must be wiped using alcohol-based spirit and regular laundering is recommended for the cover. Thermometer should be cleaned with detergent and tepid water or wiped with alcohol rub in between patient use. Storage. Let us now see how we can avoid contamination in our health centers. Contaminated items must be re-sterilized at all costs. Keep the sterilized item in a closed cabinet. Arrange cleaning and storage flow in an organized way, from contaminated items, decontamination, cleaning, sterilization, or a high-level disinfection to storage. HIV and hepatitis B prevention. We are at increased risk of HIV and hepatitis B infection, as we frequently come in contact with infected blood, amniotic fluids, and other bodily fluids. Virus transmission can also happen through needle stick injury while rendering services. All our staff at health and wellness centers should take hepatitis B vaccine and wear PPE. In case of exposure, it is advised to take post-exposure prophylaxis (PEP) for both HIV and hepatitis B. Hope you are now more aware and have carefully picked up all that you have learned and will follow these measures in your course of work. Thank you.